charge of the hospital system that received the state's very first COVID-19 case. And then Bryan Mills was diagnosed with the virus too. Earlier today, I talked with the head of Community Health Network from his home. He's still there recovering, and he also is leading a team of thousands and thousands of healthcare workers right here in central Indiana. Bryan Mills, head of Community Health Network, thank you so much for joining us.
Thanks, Anne-Marie. Glad to be here.
So you have this unique position of being the head of one of the state's largest hospital systems and also being someone who is at home dealing with COVID-19 and recovering.
Yeah, that's not exactly the combination that I was looking for, but yes, I'm here. I've been in my basement for going on 2 weeks now. And like everybody else, I'm adapting. And I'm adapting and finding different ways to communicate with people. And we're going to get through this.
You're an interesting person in the fact that, so many people say we're hearing about the people that are at the hospital, but what about the people that are home recovering? What has it been like to be in that situation where you're quarantined and isolated and, the symptoms, the struggles?
I'd say the symptoms have been really interesting. I think I had a mild case of this. I'm almost done with, I'm coming on the other side. I've just been unbelievably tired, and I sleep a lot. I sleep, most of my sleep happens here. I just brought my feet up. But on the whole idea, at some point in time, you got to say, this is how it is. This is the hand I've been dealt. I have a responsibility to lead this organization. I got to figure out how to lead from here. So with technology, like what we're doing here now, with all kinds of calls and all kinds of ways to communicate with people, we're getting it done, and we have to. We don't have a choice. We didn't ask for this. We're in the middle of it. Well, I would say we're not actually in the middle of it. I've said to my team several times that if this were a football game, we're in the first quarter, and people don't like hearing that. But we've got to continue to find ways to support people, to calm people down, to understand we have people that are dependent upon us. And our job is to serve our community, and we're going to serve our community. And that changes daily, how we do that, but we're going to serve our community.
So your community is your employees, and then it's the greater community, the patients and the patient families that rely on your care. Talk, first of all, about your employees, how many you have, how they're doing. Are you believing that you're going to be tapping into this medical workforce reserve that's being set up by the state?
I don't know that we will at this point. We have 16,000 plus employees. We have almost 600 today quarantined, like me. We have 2,000 people in our supplemental staffing program because their jobs have changed. We closed their location. I've told those 2,000 people, and then we have just over 900 physicians who's in advanced practice providers, their job has changed. And I've told both of those groups, as long as you'll do the job we ask you to do, you're on our payroll. We have not laid anybody off. I have no intention of laying anybody off. And the reason is I need them. We have a job to do. This job is growing. It's not over. So this pandemic is coming our way. We're not through it. So I've had, the other day, we got word from over 900 physicians and advanced practice providers that while they have not worked in an emergency room, in an ICU, in a hospital in years, probably since training, they raised their hands and said, I'll do whatever you need me to do. Had retired doctors, retired nurses reach out to me and say, where do you need me? That's what we need. And all of us are doing things that we didn't think we'd have to do, but we're going to do it. And with our employees, we said, we need you to be willing to be trained. We had a group of people who worked in doctors' offices that raised their hand a few days ago and said, I'll work in a hospital. What do I need to do? And now they're working the third shift in the hospital. So we just got to all understand that we've been tapped on the shoulder. We've been called to do this, and we'll get people through it. And we're going to do everything we can to keep them safe.
We've come a long way from the first patient testing positive in the state of Indiana being met in your parking lot overnight to where we are now. How many coronavirus patients have you treated since then in the Community Health Network system, and how are the outcomes?
I don't have a number on the total we've treated. I can tell you right now we have about 80 in one of our hospitals right now that are COVID positive. We have another about 140 that are under watch because they have symptoms. So at any point in time, we've got a couple hundred in one of our locations. We have had some people pass, which is really hard. It's really hard today. I mean, to think that this is happening and we have no visitors. So we're really trying to figure out how do we use technology like this to help people with their loved ones. And there's all kinds of issues related to that and technology, but we're getting better. So that's a piece of it. We have, testing has been an issue in our state and many other states. Part of the problem with our predictions and our predictive analytics, trying to figure out when this is coming, is that we only test people that are basically healthcare workers, inpatients in a hospital or inpatients in an extended care facility or nursing home. So our data is really skewed. And so we really don't know that piece of it. So, but we're doing the best we can. And we continue to search for PPE, personal protective equipment. And we're doing better at that. We're understanding better from the CDC and others as to what we need to do to protect ourselves too. So this is happening live. This is not something any of us have prepared for.
Bryan, thank you so much for your time. We'll leave it there. We wish you a continued recovery. When do you think that? When does your quarantine end?
I'm a couple days from officially ending. And, I'm told I'll have immunity. That's great. I can go back to the front line and be arm in arm with our caregivers.
Bryan, thank you. We'll be checking back.
Thank you. You take care of yourself, please.